add something for opening? I think I can.
Absolutely.
Okay, that's
We're
welcome to the
happy to have you here with us.
welcome to the first live broadcast of the European Federation of Shar Pei Clubs. We are very glad to have you here today, and we are very happy you are with us. This is our first inaugural live stream, and we believe we have managed the technical details to connect with you seamlessly. Honestly, I should say that it was a little bit challenge for us, and today I can say we dramatically improve our technical skills. That's, thank you for the question you are already sent, and I would like to encourage you to send another question during the broadcast by writing them in the comments. Just be careful, you should be in video. Click please in the video, and on the right side you will have comment section. Then you write your new question, and we will do our best to answer as many as possible at the end. Today, I'm pleased to welcome Dr. Juraj Hanzel from the Hanima Clinic in Prague. Dr. Hanzel specializes in small animal veterinary care with extensive experience and expertise in the dental veterinary medicine. His clinic provides a full range of services for small animals across various health needs, and honestly, I can say his willingness to engage with the public has been a great motivation for us to go live today. This broadcast is moderated by Victoria Potapkina, who heads external communication of European Federation of Shar Pei Clubs. And you know, Victoria is an enthusiastic advocate for purebred Shar Pei breeding, and her dedication and energy are driving forces within our club. She deserves our thanks for hard work full year. So, Dr. Hanzel, Victoria, we are happy to have you here, and I will now hand it over to you. That's all from my side.
Thank you very much. So, without further ado, let's kick off from the very beginning. We have a very small introduction on the topic of medical conditions related to longevity. So, as our dogs grow older and hopefully live longer, more fulfilling lives, we will unfortunately, sadly, see them have new medical conditions come up in relation to this. I'll pass it over now to you, Dr. Hanzel, to give us an introduction.
Okay, thank you so much. I hope that I'm sharing right now my desktop, and it should be fine right now. If not, just tell me, okay?
Perfect, I can see it.
Thank you for introducing me. So as my colleague said, we gonna talk about the medical condition related to longevity in dogs. It's gonna be pretty quick one because then we have plenty of questions, and I would like to answer of them. So, as has been mentioned, I'm a veterinary doctor and I'm focusing on veterinary dentistry. So, it might be a little bit like a small field, only a veterinary dentistry, but I can meet during every one examination different kind of dogs. They have different kind of problems, and usually we can see like a really old dogs in a general, so we can speak with longevity in a general. So if we are talking about the long-term or long life in dogs, we should consider some specific condition, and I would say at the beginning, and the most topic, it's gonna be osteoarthritis and some joint disease. I will quickly give you some facts which one might be interested. So if we are talking about a joint disease and osteoarthritis, it's the most common age-related condition in a general, in large or giant dogs. And almost I would say 80% of dogs over the 8 years, they can meet the osteoarthritis. So we are talking about that almost every dog has this kind of problem with this kind of condition. So usually it's pretty easy to recognize that your dog or even cats, they have a problem with osteoarthritis because the signs are pretty obvious. Usually it's a stiffness, pain, or reduced mobility. And of course, that this kind of condition can affect quality of life in your dogs, okay? Especially a pain. If you are talking about the osteoarthritis, then we should as well speak about the obesity or overweight because it's going hand by hand, I would say. Because if the dog doesn't have a proper movement and proper exercise, it can be heavier and vice versa. So general recommendation is to do a regular vet checkups, and we're gonna talk about this later on, and we will talk as well about the omega-3 fatty acids, glucosamine, chondroitin sulfates, and so on. So basically, we are talking about a supplementation. So this, as I mentioned, this is gonna be a real like a quick check the general conditions or like the major problem in the dogs if they are getting older or elderly. So the second one is a heart disease. Another, I don't want to call it like a fun fact. So basically it's a fact. So we might have some kind of problems like the mitral valve disease or dilated cardiomyopathy, especially with large dogs. What is really bad and not fine for dogs that they are developed gradually. So what does it mean? It means they are coming slowly and we are not able to really recognize perfectly and correctly. Usually you can see some kind of a specific signs like a cough, especially morning cough, morning productive cough, difficulty breathing, shortening of a breath, reduced stamina. So that's the major signs which one we can relieve. And for example, in our clinic or in my clinic, if you have a dog with a heart murmur, every time we send this dog for a cardiologic examination. Unfortunately, we don't have a cardiologist on our clinic, and maybe soon we will have. But right now we are cooperating with another clinic, and they are happy to examine our patients. So if the vet mentioned that, listen, your dog has a heart murmur, don't hesitate. Ask about the near cardiology center, whatever, and just examine him or her. Okay. Kidney disease. This is a really specific disease for cats, but as well for dogs. So 1 from 10 dogs might be affected. What is another fact is that naturally functions declines with age. That's a fact. And they've got a really subtle signs. It means they are coming even even like how can I explain? So you are not really able, even we like vets, we are not really recognize if some dog has a problem with the kidneys. So that's a reason why we still offer with older dogs to the blood test, blood works, because at the beginning only the blood can tell you if the kidneys are okay or not. So usually when we are able to see like a first signs, which one might be increase of thirst, weight loss, lethargy, more urination and stuff like that, we can find out the dogs with chronic kidney disease in a stage 3. For clarification, you have stage chronic kidney disease is a stage from 1 to stage 4. If you are talking about the stage 3 or stage 4, we are talking about the problem is developed as roughly about 60 to 70% of kidney tissue is not able to work correctly. So only 20 to 30% of kidney tissue can work. So that's the fact. So it's a really good point to do regular blood checks from the elderly age. Another one, cancer. So cancer is not really a pleasant topic for speaking, but we need to mention about this, that everyone for the dog deal with a cancer during a life. So that's a fact, and of course that no one is happy to hear that, listen, your dog has a cancer and stuff like that. But some of them, they are treatable, the other they are not. And cancer is really connected with older age, with old dogs and so on. So please, as I mentioned, some of them, they are visible, the other they are not. So every time when you check the lump on your dog body, don't hesitate, don't wait, and ask the vet to do something, to do fine needle aspiration biopsy, for example. Just for imagination, if you had a lump on your body, would you wait a couple of months or even couple of years? So that's a fact. And we have to deal with this one. In the contrary, the others, they are not visible. So they are. We have a cancer. They are inside the abdominal or chest cavity, and only advanced checkups can reveal this one. For example, like an X-ray or ultrasonography. So if you are talking about the longevity of dogs, so sometimes it's a good idea to consider to do X-rays of the bones, X-rays of the abdominal cavity, X-rays of the chest, for example, or to do a ultrasonography. So we were talking about the issue. They are, I would say, they are more or less visible on the body, but we should consider as well some kind, we call it a dog dementia. It's similar to Alzheimer's disease, so we can call it, or you can find out in on an internet. They call it differently: cognitive dysfunction syndrome, canine cognitive dysfunction. So basically, it equals dog dementia. The fact is that almost 30% of dogs in age from 11 to 12 years old, they might develop some kind of dementia. But if you have a really old dog, like a 15, 16 years old, almost everyone might develop some kind of dementia. So the signs, we will talk about this signs, they might be very different: disorientation, confusion, changes in behavior, altered sleep-wake cycle, and so on. So what is really important to mention is that, of course, that it might affect quality of dog life, but in a general, affect the quality of life of owner's life, because, for example, if dogs do vocalization during the whole night, even the owner are not able to sleep correctly, and we should do something with this. So, and that's another, like, a long story how to deal with this kind of condition. So we might treat the dogs with some kind of supplements like vitamin C, E, selenium, and so on. And as well, we can do some kind of a mental exercise. We will talk about this, because I have seen some questions about the mental exercise with dogs. So you have been, guys, curious about this. So this is a minefield, dental disease. So I would say that I'm able to speak about the dental disease maybe for whole day. So just very quickly to say something about this. So almost everyone dog can develop periodontal disease. So there's a fact that when we open the mouth, almost everyone dog might some kind of problem with periodont. So it means, like, we are talking about gum bleeding, redness of a gum, and stuff like this. Some of these diseases are mouth related. So if you have a pain inside the mouth, you are not really happy to eat because it's a chronic pain. And if someone of you guys has a tooth pain, you know what I'm talking about. It's not really pleasant pain. And usually dogs, they can lose of appetite. So that's the first signs. But the other if we are not treat perfectly dental disease, it might be connected with some body or body problems like the heart issue, kidney issue, liver issue, and for example, pancreas issue. It's a study, it's from a human field that the people, they have a dental disease, I mean parodontosis, the probability to get diabetes is 3 times higher. So, and the similar is with the dog mouth. So, what's the best way to do something with and keep the tooth or teeth in a well condition and gum in a well condition is to do regular brushings. So that's the alpha and omega. So that's the first things. We call it like a active treatment, and you can use a passive treatment as well to do some or offer some special dental foods, dental chews. And the last thing is a professional cleaning. This is a really big topic, and we will talk about this later on, because the professional cleaning needs to be done under the general anesthesia. Obesity and metabolic disorders. So fact is that every second dog is obese or overweight. So of course that someone has obese or is overweight, so osteoarthritis is coming and vice versa. So means obesity is related with other disease like diabetes, heart disease, osteoarthritis. But in the contrary, when the dogs has a osteoarthritis, they might develop obesity. So it's like a circle, and we have to cut this kind of circle. On the other hand, we might have some kind of conditions like a hypothyroidism, and they can because of obesity. So again, the regular health checks and the blood works really can help us, like a vets, to discover where the problem is and deal with this kind of problems. So, and the last topic is liver disease. Regarding liver disease might develop in any age. So that's the reason why I put it on the last stage. And what is necessary to realize is that it doesn't not exist the specific treatment with the liver disease. We have only supplements to make the liver better. So that's the fact. So, and again, the regular checkups and regular blood works can really help. So when we do a conclusion, what's the strategy to support longevity is these topics. Do a regular veterinary checkups, okay? Annually, every 6 months, every 3 months. So, but do it regularly, because if you do it regularly, you can notice like a small changes, and we can fetch or catch basically this is at the beginning. So you can do a regular checkups, then you can do a balanced diet and weight management and just maintain the proper weight for your dogs. Then we're talking about the dental hygiene, and you can do a proper dental hygiene. Then we can do some kind of exercise. It means like a physical exercise and as well as mental exercise. And as well, we can do some supplementation and apply some medication. These two guys, so basically we are at the end of my small presentation. These two guys are our dogs. On the right side is a Hugo. He's at 14 years old. On the left side is a Bella. She's at 12 years old. So if you are talking about the longevity, I'm on the same boat with you guys, because basically we are dealing with the same problems. Bella, she has no problem. She's a rescue dog. She is just hyperactive, that's it, okay? But the other guy, he's got a whole bunch of problems. So I would say that he's getting a canine dementia right now. He's got a cataracta. He's got some kind of problem with the joints. He's a little bit overweight, even though because he is not really keen to do exercise, but he likes the food, of course. As well, he's got an atopy and he's got hypothyroidism. So it's like a really whole bunch of problems, and we have to deal with this kind of situation. So that's it.
Thank you. Thank you for a great introduction to the topic. And it's nice to see that you're not just a veterinarian and a professional, you're also a pet owner of 2 senior dogs. So like you said, you're right there in the boat with all of us and with all of the concerns that come up with it. So let's dive into the questions that we received. And the first one is about preventive care. So you did mention that it's important. So what's a reasonable amount of preventive checkups? I think, well, maybe some, but most of us would probably not want to visit the vet every month, every 3 months, and so on. If you have a relatively, let's say, healthy dog, more or less, of course, all have problems, but how often is reasonable and how much is too much?
So none is too much, basically, because if you check the blood results, the next day they are old, basically. Okay, especially if you are talking about the intensive care. But if you are talking about a dog which one is healthy, just getting older, so that is like a really minimum to do a check annually with a vaccination, for example. But I strictly recommend to do the health check every 6 months. Okay, so I would say for elderly dogs means from 6, 7, 8 years old. Every 6 months, that's the point when we should consider to visit the vet to do a complete health check. If you are talking about a health check, so basically everything depends on money, of course, because we can do a comprehensive physical examination, which one is like a physical examination. But my recommendation to do as well a blood test every 6 months, if you have basically money for it. So to do a complete blood count, biochemistry panel, but it's a good idea to include as well a thyroid panel, some specific things like SDMA, which one can really reveal like a early age kidney disease, for example. For example, in our clinic, we used to offer like a geriatric package, which one include comprehensive physical examination, blood test, urine analysis, blood pressure measurement. So this is something like a minimum. If you have a concern, if you have a concern, for example, dog is limping or has a swollen joints, whatever, not really keen to move, we should consider as well to do X-rays and ultrasounds. But if we are talking about X-rays and ultrasounds, especially X-rays, dogs have to go under the GA, under the general anesthesia, or at least under the sedation. So if someone is going under the sedation and we will use some kind of drugs, it's a good idea to do a blood test before. Okay, so it might be like a next steps means X-rays and ultrasounds. So 6 months, that's the answer.
Every 6 months. And I personally know you enjoy taking blood from Shar Pei.
Yeah, definitely. Yeah, especially without clipping.
Yes, no shaving of the fur and taking blood. Thank you for that. I personally underwent the geriatric examination with my dog very recently.
It was good, wasn't it? It was fine. Okay.
I'm happy to say so. When we talk about weight management, that's an important topic for as dogs get older, they start moving less, they like to eat more. and weight management. How important is it? What are the most common weight-related problems and risks for senior dogs? You touched upon it, but I think it was asked, so it's a very important topic, I think.
It is, it is. So, short answer is yes, it's very important, weight management. So, I used to recommend to our clients, check the weight every time as it possible. So it means you are going on a walk, for example, you are going by some vet clinic, jump inside, check the weight. Usually in a waiting room, you've got weights, and we are happy to check the weights. So, and you can see how the weight is going up or down or whatever. Okay. So it costs nothing basically. And I would say no one kick you out. So this is a quick check. How can you check and manage the weight? Of course, if you are talking about the weight with all dogs, the truth is that the metabolism is getting slower. So if you don't have that's the first thing. The second thing, the dogs, they are not really happy to walk a lot or run a lot and so on. So basically it's the same like with a human being. And as we are getting older, we are not really happy to move a lot. So, but we still can enjoy the food. So it means the income is higher, but the outcome is lower. So what's happened? Obesity or overweight is coming. So if the obesity or overweight is coming, we have a higher weight and our joints are suffering, our heart are suffering, for example. So the answer is, what was the question? Here is it. What are the most common weight-related problems? So the most common related problems are osteoarthritis and consequently the pain, which one is connected to osteoarthritis and heart disease problems. So that's the answer.
I think when we talk about weight management in senior dogs, everybody sort of gravitates towards overweight and obesity because we see that a lot. But a senior dog losing weight is also a very important sign to watch out for, right? It could indicate big problems as well.
Yeah, so that's the other side. If the dog is losing weight, so it might be some reason. So the question is, you have to dig a little bit deeper. So what's the reason of a losing weight? So my first question is, does your dog eat properly or not? Okay, so if doesn't eat properly or is not really happy to eat, what's the cause? What's the problem? Why your dog is not happy to eat? It's not happy to chew. It's not happy to eat. That it's a tasty food. Of course, sometimes it might be the problem with the food because it might be, sorry for a expression, it might be a shitty food, and dog is not really happy to eat. But if the other problem is really like a mouth related. So if the dog is under the pain, it might be another problem. So first you have to realize if the dog, if the income is or isn't. So if the dog is happy to eat. So if the dog is happy to eat and losing the weight, then you have to dig a little bit more and check it. Why is like that? Okay. If the, for example, if the protein quality is okay, okay, because that's the major. The proteins has to be really in a good quality. So if you, I don't want to open this Pandora box, I would say, with food, because as I mentioned, is exists shitty food is a good food and so on. So let's move a little bit.
The next question on my list.
Yeah, so let's move a little bit forward. So
the question is, what's the best balanced diet for a senior dog?
Yeah, so that's the balanced diet. So okay, so let me finish this first. So you can as well, you can lose the proteins by urine. So that's another fact, and it's related to kidney disease. So if our dogs are eating properly, has a good quality of proteins, means good quality of the food, but still losing the weight. So usually the problem is that they are losing the proteins. And if they are losing the proteins, the problems or the problem is in the kidneys. And we should focus on kidneys then and check the blood. If the kidneys parameters are okay or not. If they are not okay, we should deal with this kind of problem. So, best balanced diet for senior dogs. So that's a good question. So as I already started, high quality proteins, that's the first things. So for me, means I have nothing against the raw food. I have nothing against the kibbles and so on. For me, the most important thing is feed with a good quality of a food. If you buy it, don't buy a shitty food in the supermarkets and so on. And the food might be with a good quality. What does it mean? So what does it mean? It means your dog doesn't have an upset stomach. The poops looks fine. He is not overweight or underweight, and it's attractive for a dog. Okay, so basically pick your poison. I'm a really lazy person, so I prefer dry food or kibble food because it's already prepared. So we are not living in an 80s. Right now, the quality of food is a really really good. We have plenty of different kind of brands. So we have like a plenty of options. Okay, so it exists different holistic, grain-free, whatever you name it. So, but for me, the most important thing is dog has to be fine on this kind of food. So for me, it doesn't mean if you buy a really like expensive food that it will be good for your dog. Currently, yeah. For example, my dog, as I mentioned, he's got atopy, and we has to really like pick the specific food which is really okay for him and is not harm his skin. So that's the point. But the question was about the balanced diet. So how quality, a high quality of a protein. The second thing is we should consider moderate or low fat food. Why? Because as I mentioned previously, older dogs, they are not happy to move a lot. Okay, so the outcome of energy is lower when the the outcome is lower than with the young dogs. So we should consider of a low-fat diet. So usually senior food contains a low fat or lower fat than a normal food. As well, we should increase the fiber because the fiber is really healthy for bowel functions and weight management. So that's another thing. And as well, we should consider a couple of supplements like a joint supplementation, maybe put some more antioxidants, and maybe put some probiotics and prebiotics. For example, my dogs, they are on a probiotics on a daily basis. They can really help for allergy dogs, for, if I'm right, for Shar Pei as well. So the probiotics are really good. And even I would say they are almost necessary to add on. So if you are talking about the balanced diet, okay, so we have a good quality of the food, but put something more on it. Maybe some joint supports or joint nutritions, probiotics, and some antioxidants. Okay.
Right. So to summarize, each dog is different. Pay attention to what works for your dog. If it's not working, adjust it. If it's working, don't try to fix what's not broken. But with age, it's good to add supplements. That was one of the questions that we had, whether it's even necessary. Is it even necessary to add supplements? If they're doing fine, if their fur is fine, if they have not normal muscle weight, their joints are not showing any problems, do I need to put anything extra? Or is it enough what they're getting anyway?
Means if you are buying a good quality food, it's not really necessary to put something on. But if you don't do something wrong, if you add on joint supplements, okay, they can really help, and probiotics. Okay, so these two things are, I would say, they are really important for older dogs, and maybe consider some antioxidants like vitamin C, vitamin E, and so on to top on. So, but you can find them in a different kinds, like some pills, some liquid, and so on. So basically, pick your poison. But we are still talking about the supplementation, no about the drugs. So you have to find out which is really good for your dogs, and dogs they need to eat it. So some things that are really attractive for dogs, the others they are not. So I remember that we were dealing with some probiotics, and our older dog is really picky. So we used to say approved by Hugo, and if something is approved by Hugo, it's a really tasteful. So yeah.
Great. All right. We do have a very specific question about chronic intestinal disease. And if you could speak a little bit about that, how do you help a dog gain weight on it, and what's the recommended way to feed dogs with that disease?
So good question, and I'm gonna sneak out a little bit of this kind of questions. because really is as I know, it exists like a new studies about the chronic intestine problems. So I would focus, or I would switch this kind of question to my colleague, because really this is not really not my field. But generally speaking, if you have a problem like a chronic problem with the intestine, I strictly recommend to do something more like to check regular biochemistry, but top on with checking vitamin B9 and vitamin B12 and some specific enzymes, which one is related to pancreas, and we call it TLI. So, and we have something like a chart, and you can compare if you have a small intestinal bacteria overgrowth, or which kind of problem do you have. So, but usually these kind of problems end up with EXLAP. It means with opening the abdominal cavity, pull out the small intestine and do a samplings, because we still need a sample to send it for evaluation for histopathological examination. So I would say maybe 80–90% will end up like this. So yeah, that's the reality.
Okay, well, on a happier note, then let's turn to physical activity in senior dogs. So how much is healthy for a senior dog, and what kind of exercise do you recommend?
Depends. Depends. If you have a small idiots like we have.
No, we all have Shar Pei. We have medium idiots.
There are another kind of idiots, but in a good way. So
a little bit bigger, medium sized.
yes. So it's so general recommendation. What is a general recommendation? To do to do exercise from 30 to 60 minutes a day, and divide it into a couple of sessions. Thank you. Couple of sessions. So depends how many times do you used to go outside. So if you used to go outside 3 times a day, so 20, for example. Okay. If you have a dogs like a Shar Peis or like a Czech Russell Terriers, you have to a little bit increase, because they are really energetic and they need get rid of an energy. As well, it depends on everyone's specific dog. So now I'm able to see. So I'm gonna speak about my dogs as well. We've got 2 old Jack Russell. One of these, he loves to sleep, and that's it. And he loves to walk. The other loves to run and do crazy things. So now, what's the good for them? So we have to find some of consensus, and do it okay with both of them. But generally speaking, from 30 to 60 minutes, it's okay. But if we are talking about the older dogs, they might have some kind of problems with joints. So we still recommend to do a gentle walk, for example, instead of crazy running, jumping, and so on. So gentle walks are okay. If we are talking about an older dogs, and they might have some kind of problems with the joints, as well, swimming is okay. But don't force your dogs to swim if they didn't get used to it. So if they don't like a water, don't throw them into a water, obviously. Okay, so swimming is for dogs. They like them. No, they like it. Okay, so then you can do some interactive play games. Okay, like low impact fetch or tag and stuff like that, if dogs like it. Now I'm gonna talk as well about the dental disease. Now, general fact, if dogs has a dental problem, they are not happy to do fetch or tag. Okay, so because it's painful for them to pull something and choose something. You can as well with older dogs. What can you do? You can do a stretching, for example. You can do a stretching at home, okay, to do full flexion, full extension, and vice versa. You can combine it even though. So this is a physical examination, but you can combine physical and mental examination. So if you do some kind of commands like a sit, stand up, stay, and so on. So we call it, for example, puppy squats. And puppy squats means that sit and stand up, sit and stand up. So it means basically this movement is a squats for dogs. And you can combine a physical examination and mental examination. Okay, so with some kind of treatments later on. So as well regarding walks, sometimes, and it's happened yesterdays, like I was planning to do like a walk, like a really it's not like a long walk, but more like a normal, almost 1 hour walk for my dogs. But instead of them, they found out mice in a park, and they like to hunt them. They like to dig. So we switch it, and we switched the physical examination to some kind of mental examination with sniffing and stuff like that. So we spent 1 hour in a park without any movement by wall, but plenty of mental movement, if you can call it like this. So that's a physical and mental examination. But one thing, what I wanted to say, please don't forget for warm up and cool down with your dogs. Because if we are talking about an old dogs, it's not a good idea basically to wake up your dog, go out, and literally just throw the ball away and bring it back. Okay, so some warm up, it might be over there, so like a walk, and then start with exercise. So basically, I used to compare with a human being when we used to go to a gym. We don't put like a 200 kilograms on our shoulders and do squats. Okay, so still warm up and then cool down. This is another really important thing, and we can protect some injuries.
Absolutely. That's really good advice, and it's super easy to forget because
Yeah.
I think people, especially with the garden, in the morning we open the door and we let the dogs out.
Yeah.
Off they go.
That's it. Yes, exactly.
So this is something, especially with older dogs, I think it's important to pay attention to this. Well, we'll circle back to mental stimulation and cognitive issues and so on. But first, let's talk about joint care. And what's the most common sign of early onset of the problems? What can we all watch out for as owners? And then how do we manage it if they do happen?
So, what's the most common signs of joint problems? I would say that it's pretty easy to recognize, sometimes not. Okay, so the first sign is the slowing down. Okay, so it might be age related. Oh, okay, dog is getting older, so it's slowing down. So it might be okay, it might be not. So, but we start to be a little bit worried about, okay, so my dog is slowing down. It's a problem, it isn't. So observation in this one case. But if you notice another changes like a stiffness or limping, don't hesitate, visit the vet and tell him, her, that listen, we have this kind of problem. We have, I don't know, swollen some of a joint. We have a limping of this leg. Of course, that many times we are not able to see any limpings in a clinic. The reason is dogs are under the stress, so the adrenaline level is higher. They don't feel the pain, then they are not limping. Okay, so but still, guys, you can do a video. You can send a video. You can show us the video. Many things they are osteoarthritis related or joint problem related. They can they are visible after resting. So not in a clinic, but when the dog wake up, might have a problem. Okay, so maybe a little bit like a slower than a normal, even the yelling and so on. Okay, the other changes might be like a vice versa, like a restlessness. Means dogs, they are not able, or they have a difficulty finding a comfortable position. So they are not sleep well, they are edgy, grumpy, and so on. So they don't sleep okay because they are under the constant or chronic pain. So that's another common signs that they are not sleeping well. Then you should be able to see changes in a body language or posture. Like, for example, tucked tail means like a tail between the legs, for example, okay, or the back is not in a straight position, it's a little bit bended, okay, it might be as well. It might be as well a problem, and which is really obvious if the dog is really I would say aggressive or avoid to touch any certain area. So it might be back, it might be specific joint. Okay, when you touch it, he start to yell or even try to bite you. Okay, so this is the really common signs with joint problems, and obviously swollen area, like a specific area, and especially if it is a worm. Then what was the second question? What is the how can we prevent this?
Or what can we do when we see it?
So what can we do? Visit your vet. So that's
Good advice.
so means so it's limping. Oh, okay, so again, depends on how bad is it. So if it is like a really slight limping or not, so it is a really slight, so you still can, for example, consider some observation and waiting maybe 7 days. Give them a rest. Okay, so no excessive exercise. Just like a little bit of a walk, and that's it. And you'll see in 7 days time how it will work, because sometimes it might be only a sprained muscle, sprained tendons, or whatever like this. It just needs a time. So usually we can give you the same advice. Okay, no excessive exercise, and maybe we will give you some painkillers, because we cannot do something more. It takes time, obviously.
Before we jump into the topic of pain management, there was also a question about at what age does osteoarthritis normally begin in large, muscular, and healthy older dogs?
What's the question?
Give us an age, please.
It might it might develop in any age. So depends.
In healthy dogs,
Healthy. So let's talk about the healthy big or giant dogs. It might be something between from fifth to seventh age, so from fifth to seventh year. So means when they are getting elderly. Okay, so with small dogs might be 8, 9 years. middle age, I would say we are talking about the 7, but with the giant or big breeds from 5 to 7 years old. But again, it depends. It depends. You can have a really completely healthy dog, but it's the same situation like with athletes, for example. And if you do exercise over than is a normal, you can overuse your joints, literally. So it means like everyone, like a professional athlete in their 30s, 40s has a problem with the joints because they overuse them, overtrained them. So which is not good as well. So you might be completely healthy or you might be really in a perfect shape and condition, and you might develop osteoarthritis.
Mhm. So again, very, very individually, individual cases.
It is, but generally speaking, it's related to older age, means when they are getting elderly, so from 5th to 7th years of the age of the life.
It's very concerning that you're saying 5 years old is an older dog.
I know. Sorry about this, but
Yeah, okay.
so statistically, you asked me about maybe some kind of a statistic, so this is statistics. So
Okay.
that's
Let's move on to pain management. You mentioned it before. One of the questions was, what are some of the signs? This is a more specific one. So it's not just signs that are obvious, but what are some signs that could indicate a senior dog might be in pain, especially in cases when it's not so obvious? And maybe a bit of context for this question, because I can understand where it's coming from. Generally, a lot of Shar Pei don't show pain so easily. Their tolerance level is a little bit different. They don't like to be so expressive about it. So maybe the dog could be in pain, but not overly showing it. Is there some way that we could see these small, subtle signs?
ask them.
Great.
Sorry.
Next question.
Okay, so I'm just playing with you guys. Okay. So it
So
would be
is there something that we can notice that we could say, okay, this isn't quite right. This isn't exactly what should be happening.
but it would be really perfect to just come to
Wouldn't it?
and just ask the dog. So listen, so what is a painful? Which kind of joint, the body, or I don't know, just explain things. So
Yeah, where does it hurt?
yes, I would appreciate it a lot.
Then it would be too easy.
Yes. So now sometimes we have to be like a Sherlock Holmes. And I mentioned it previously. So some signs they are coming very, very slowly but surely. And especially like a slowing down and a stiffness. Okay. So sometimes it's very hard to recognize if someone is really like a stiff and it's walking like a robot, okay? And especially when you see your dogs on a daily basis. So that's the problem. But for example, as I mentioned previously, restlessness, like not able to rest correctly and not sleep well. This is a really good good signs which one you can notice that the dog is walking around, not able to sleep perfectly, even though he's got like a plenty of spots, like different kind of beddings, couches, and so on. So I would say this might really really tell you that something is wrong with your dog. Then, for example, changes in social behavior, for example, maybe some irritation, even though aggression, for example, they might be more aggressive because they're under the pain. So just imagine that you are under the pain and someone is wanted to you, or how can we how it might be really difficult to deal with other people if you are under the pressure, under the pain. I don't know, no, or didn't sleep well, so it might be problem. Okay, it might be problems. For example, for cats, but you can apply into a dogs as well. If they have some kind of a joint problem, they are not really keen to jump a lot like previously. They're more likely climb instead, okay, or jump. So you can notice, for example, with dogs, okay, so that they are not really happy to jump like previously. They did plenty of different kind of run and stuff like that. So or walking to a stairs, for example. Okay. So, but if you are talking about the pain, and I'm a dentist, so you can find out like a changes in an eating or drinking habits, loss of appetite, for example. That's really, then you start to consider checking the mouth. How does it look? How does it look like inside the mouth? Bleeding from a mouth, bleeding from the gum, for example. If you offer some kind of chewing treats or some kind of toys, and you notice that it's a blood on it, so then you should consider that something is wrong. So bleeding from a mouth is not okay. Okay, so it's the same like a bad odor from a mouth is not okay. So it's not fine if dog has a smelly breath. Okay, so it's a different kind, different smell than a human being, but you cannot feel something like a putrid, if you know what I mean, like with a pus smell. So which is not fine. Then sometimes, and my colleague, she still send me some dogs for another clinical examination, X-ray examination. We have a couple of cases that dogs came to clinic and has or licked the paws excessively, and the owner thought that the dog has a problem with the skin and has some kind of dermatitis, allergy, and so on. But many times, obviously, dog are not able to tell you, so listen, it's painful for me, and they do another expression and they just lick the, for example, front feet or feet, and after when we done an X-ray, we will be able to see osteoarthritis on the carpus, for example, this part. Okay, so excessive leaking on a specific area might be some kind of signs of a problems with pain, for example. Okay, and go back to mouth, rubbing the mouth, doing something like this, excessive rubbing. It's another signs of a pain, for example. So this subtle signs might tell you something more, that dog has a problem, is under the pain or chronic pain. But as you mentioned, they are stoic animals, and they are not happy to show you that they're under the pain. So yeah, that's the reality.
Well, what about chronic pain?
Mhm.
The question we have is, how can we help a dog deal with chronic pain and maintain a dignified and full life for as long as possible?
Get rid of a chronic pain. So
Okay.
means first. So maybe I will tell it again. So first you have to realize what's the source of the pain. Where is the pain? So, and then we have like a different kind of approaches. Back to dental, if you have a dental pain, extractions, do something more, do evaluation where the problem is. So first thing is you have to find out where the pain is. So, but if we have a problem with the joints, for example, elbows, hips, and so on, we are not able to easily get rid of. Okay, so sometimes they can go under the general anesthesia and do a hip replacement or some another kind of a replacement of a joint. But regarding elbow joint, it's impossible. Hips we can replace. So if we are not able to do a procedure, for example, we have to do something something differently. And fortunately, we have some kind of a drugs. They can really help. And so let's speak a little bit about the drugs. So at the beginning, or the common drugs are non-inflammatory drugs like NSAID. Nowadays, there exists like new drugs. They can be really gentle to a kidney and to a liver. But every time, if we put the dog under the non-inflammatory drugs for long term, we still recommend to do a blood check every 3 or 6 months. It's not about this that this kind of drugs will destroy your kidneys, but we need to be sure that the kidneys are completely okay and the dog is not dehydrated. Because if the dog is dehydrated and volume of a blood is lower than a normal in the kidneys, then we can destroy the kidneys. So generally speaking, they are pretty safe drugs, but we need to check the blood regularly. So that's a first thing, non-inflammatory drugs. So then what can we use? Then we can use, for example, a pentosan. Pentosan is a specific drug which one can increase the volume of a synovial fluid and basically lubricate the joint from an inside. Even though we can use a hyaluronic acid directly into a joints or IV, I would be a little bit more concerned with Shar Pei. How does it work? Hyaluronic acid with them and so on. So that's only one thing. But with normal dogs, I'm not talking that they are abnormal or something like that. But with other dogs, hyaluronic acid is working perfectly. Okay, so that's another thing. Then from drugs we can use, for example, Librela, which is really safe because it's a monoclonal antibodies against a nerve growth factor, and basically it's working like it can inhibit the cell signals from nerve growth factors and basically from the joints where the osteoarthrosis or arthritis is. So pros and cons, especially cons, is that it's an injectable version, so you have to visit your vet regularly on a monthly basis. And because it's not working immediately, it takes the time, at least like 2 weeks. You have to keep the pattern and do it on a monthly basis. So these are drugs, and these drugs can help. If we can speak about the off-topic drugs, of course, I should mention anabolic steroids can help, but this is something like which is illegal or like a gray zone. Okay, so but we know that professional athletes they can use it, and in dogs sometimes people they use it and it's working, especially after procedures. Except drugs, we can use as well, for example, hydrotherapy and laser. Okay, so we don't have a laser on our clinic, so I cannot tell you if it is work or not, but according to my colleagues, it's working good. And hydrotherapy, usually orthopedic clinics, they used to have it and they used to offer a hydrotherapy after procedures. So
We actually very recently had a podcast episode about physiotherapy in dogs, and we spoke about laser therapy and how it can help dogs, older dogs manage. Well, not only older dogs, but dogs with joint problems, improve, even manage, and then possibly also improve. And not to jump ahead, but maybe a little sneak peek for whoever's listening and watching. We will soon speak about CBD and how it can also help dogs with pain. But that's for the future. When I think we can wrap up the topic of pain management for now and go on to your favorite topic, which is dental care.
Okay.
Yeah, and I think you've touched upon it extensively so far. The first question we had was how important is dental care for the overall health and well-being of a senior dog? And I think it's safe to say that very important. And you've mentioned it multiple times so far. But what's the best way to maintain dental hygiene for senior dogs? Is it any different than with younger dogs? And also, I think here could be important to, because sadly, dental care is neglected very often. The sad reality is that majority of us are guilty of not brushing our dog's teeth every day or every week. If that wasn't the case, if occasionally we brush the dog's teeth, occasionally they get a dental stick to chew on, maybe we put something in their food. When they become a senior, is it too late to start brushing?
How can I start? So means I used to ask people what's the trigger to do a toothbrushing on a weekly basis or even on a monthly basis. So it's like my personal question. So what's that specific trigger that you realized right now? Oh, okay, so I need to do a toothbrushing because I haven't done it for 7 days or 30 days. Okay, what is it? So no one can tell me. So never mind. Never mind. Regarding tooth or teeth, is the same like with a human being. Alpha and omega is to do a toothbrushing on a daily basis. That's it. That's a really short story, and
The long story? So there's
it's a pretty long, but yeah, toothbrushing is the best way. How can you maintain dental hygiene with everyone, dogs, cats, you name it. It's never too late to start with the toothbrushing. I can personally tell, as I mentioned, Bailey's, our young lady, 12 years old. She's rescued. We have her from her 9 years old, and she wasn't willing even to show the teeth. Right now, she's happy to do a toothbrushing on a daily basis. She's like, let's do it. So you can learn, you can teach the dogs how to do it. And what's the best way is to do a positive approach. Don't force. At the beginning, it might last maybe 5 seconds. That's it. Okay, but do it constantly every day or every evening or before sleeping, every day, and you will prolongate it, and then you will be able to brush it correctly. Why it is so important to do a dental brushing on a daily basis? Because as we know, we can have biofilm inside the mouth, and it's like a permanent war between our toothbrush and the biofilm. We are not able to get rid of a biofilm. Okay, it's still over there. We can reduce it or reduce it. And if you leave it like it is without any reducing, then it can cause some kind of a dental problem. So generally speaking, even though the tartar is not problem, the problem is plaque. Plaque can cause dental disease, not tartar. Tartar just looks disgusting. That's it. But the plaque is the problem. You mentioned some chewing sticks and stuff like that. So
maybe also different like kelp powder that you can put
yeah.
into the things like that.
So kelp, according to me, it can help. It can help. It doesn't exist like a specific study because it's impossible to split the mouth on a half and half and check it. How does it work? So, but according me, it's help. That's the first thing. Regarding dental chewing supplementations or sticks and stuff like that. First thing, it's not good idea to put inside the dog mouth everything you are not able to bend. Okay, so if you are able to bend, then it's suitable for a dog mouth.
Okay,
If you are
interesting.
not able to bend, it's
Don't
not
give
good
it to
idea,
them.
it's not good idea to put inside a mouth. Now some people can disagree, and how about the raw food and raw bones with plenty of meat on it? Yes, that's right. You can use them, but as I told as I told right now, it's not like a whole. It's not like a just bone need to be covered with the tendons and with cartilage and with some kind of meat. That it works. Okay, so we have a couple, no couple. We have plenty of cases that people feed dogs with the raw food, and the dogs they have almost no tartar. So that's another thing. But again, we should realize if you do a chewing sticks, they are working on a carnassial teeth only. So dogs they should have 42 teeth, and some of them we call carnassial teeth. It's like a working teeth. It's the back big teeth that are over there, and they use them for chewing. So then use the stick like put over there and chew with this teeth. They are not chew with canines or incisor in front. So still, the chewing sticks they are working over there, but they are not working on the front. So you still should do a toothbrushing on a front teeth. If you are really into a dental, it's a good idea to go on a web page, Veterinary Oral Health Council, VOHC, and you can find out like a plenty of like basically it's a list of um, uh, of um, different kind of paste, brushes, water, and other treatments and food. They have some science behind, and they have an approval that they can reduce plaque or tartar. Okay, so if you check it correctly, the cover, and you see and you are able to see VOHC stamp over there, then you know that it works. But another but, everyone supplementation it's working for, I would say, roughly about the 30 up to 40%. Okay, nothing is working for 100% if we are talking about the get rid of a plaque, only regular toothbrushing.
Mhm.
So that was the answer at the beginning. The short story is do a toothbrushing on a daily basis. That's it.
And toothbrushing with toothpaste.
Yes or without. So maybe I'm gonna tell something new, maybe not. In human being as well, toothpaste is not really important. It can make your breath attractive, okay, because it contains mint and stuff like that. But otherwise, mechanical cleaning is the way how to get rid of no use a paste. So even though if you don't use a paste, it's okay. But for dogs, as I mentioned, positive stimulation is the way. The paste needs to be attractive. So that's the reason why they flavored the paste like a different kind of a bacon, poultry.
Chicken, I saw chicken bacon.
Yes, yes. So it can make it attractive for dogs, and they're happy to clean the teeth later on. So that's the point. But even though they put some specific enzymes into, so and the enzymes can help to get rid of a plaque as well. So that's another thing. Yeah, that's it.
And for sure, not human toothpaste. I think it's worth
No, definitely not.
reminding that nothing
Uh,
makes it fresh.
So first, it contains a peppermint, mint, whatever, which is not pleasant for dog mouth. That's first thing. It might contains a xylitol, which is a sweetener. So if you check it, xylitol is a pretty normal in some food, but for dog is a poison. So don't use it. And as well, it contains some specific salt and it can harm the stomach. So they can vomit after.
Mhm.
No human paste, please.
Good. I think it was a useful reminder, I think, for everybody. When we talk about professional dental cleaning in the veterinary office, um, and anesthesia, when you have a senior dog, is it safe to do it? Is it worth doing it? For example, a dog of a much older age of 9, 10, 12 years old, is the benefit of having professionally clean teeth worth the risks of anesthetics?
First things, maybe you know, my wife, she's a human anesthesiologist, and she used to say, doesn't exist the safe anesthesia. It's not safe to put someone unconscious. So, but the anesthesiologist can make anesthesia safe. Okay,
Mhm.
so need to know what you are doing. So that's the key. It doesn't exist like I am able to see. It doesn't matter if it is a dental procedure or the others. I'm able to see on Facebook or somewhere else that I would like to prefer a safe anesthesia like the inhalation one. So it doesn't exist safe anesthesia. So if you don't know what you are doing, you literally can screw it. So and kill the animal. Back to age. I used to say maybe it's a cliche. Age is just a number. That's that's true. You should consider a little bit like a little bit differently. So that's the one thing. It's the age, but with older dogs, of course, we would like to do complete blood works. So CBC, biochemistry, maybe cardiology examination, maybe some chest X-rays, and so on. So if you do these kind of things and you are completely sure that the kidneys, liver, pancreas, and so on are okay, dog doesn't have any other problems, the heart work perfectly, so then you literally minimize the risk at the minimum. So that's a that's a first thing. And many times it's more likely the owner problem. Sorry, guys, that my dog is really old for anesthesia. So let's consider if it is old or not, or what might happen if we do nothing. So it depends, you know. So if mm, um, unfortunately or fortunately, I don't know, we are pretty like a reference center with the dental, and then we used to deal with like a nasty nasty cases like a swollen half of the face. We have a really old dogs. So I did like the oldest dog was like a 17 years old, some kind of dental, and we cat 21 years old, and it went fine, but you know, so I was really like a small, so and after all I had to change my underwear, but
And well, that's the most.
yeah, so it works. But what I wanted to say, so you have to consider not just age or just age, but how the dog is in general and what kind of problem is it. If there is any other way, how can we sort it out, or we have to go under the anesthesia. And especially for with dental care, when you notice that dog has some kind of problem which one we are not able to fix it without anesthesia. So two things. The dog will be just older and the problem will be worse and worse. So it's good idea to do it immediately then. And regarding the anesthesia, like a quick view, I am really fun with the local anesthesia and infiltration anesthesia. What does it mean? If you visit your dentist and the dentist usually do something like a nerve block, like put a big needle inside the mouth and apply something. We used to do the same, and we can rapidly decrease the amount of anesthetic gas, for example, because we can make it numb in this area only, and dogs, they are comfy after all. So that's another safe approach. How can we deal with some dental disease or disorder?
And generally, surgery on senior dogs, senior animals. What's your view on it?
Sorry, what?
Surgery on older animals. That we
Yes.
had one of those questions. Is it safe to operate on senior dogs, and what are the most common issues you deal with in surgery?
Again, depends. So it is safe. So if you consider that the rest of the body is prepared and it's okay for anesthesia, then it's safe. So means if the inner organs are working correctly. So of course that if you reveal that the kidneys are not in a good condition, liver and so on, and it's just elected procedure, so you can skip it. So don't do that. Okay. So, but if it is a life-threatening, you have no other option, obviously. And the common issue. So let me think. What's the common issue during an anesthesia? I would say, according to my wife, it might be apnoic pause or not really able to breathe correctly. That's the issue during an anesthesia. Unfortunately, we have a breathing machine which one can really help the dogs. And what's the reason? So, and especially this is a problem with the brachycephalic dogs or dogs that have a more soft tissue they supposed to, as a Shar Pei, for example. They might have this kind of problems. So if they have problems with during a sleeping with apnoic pause, for example, or snoring and stuff like that, so they literally living or they are choking during a sleeping. That's a normal. And their respiratory center, it's a little bit more depressed than a normal, but now we are talking more of a science right now. And that is the reason why they are not really willing to breathe correctly during an anesthesia, because their respiratory center is not working correctly. So that's the issue during an anesthesia, but we can deal with. And generally speaking, if you are talking about an old or older dogs, I would say the major problem is prolongation of recovery time. Okay, so as everything is a slower, like a walking and so on. So even though the waking up is a slower, recovery time is a slower, healing process is a slower. So that's the I would say that's the major issue. So then you should count on this kind of, so it's not like it's a problem, but we can expect this kind of problems. And that's the most common problem. Okay. So no healing properly and prolongation of recovery.
Speaking of surgeries, we had an interesting question. I thought it was an interesting question. Some dog owners want to have their dog's narrow ear canals operated on. When is this necessary, and is this surgery dangerous?
I would refer this kind of dogs to a different practice, but so as I mentioned, I'm the dermatologist. Well, I'm talking about the dermatology, because my colleague, she's a dermatologist, that she used to say that dog might have a ear canal infection only once during a life. If it is more often, they have a different kind of problems, and it's more likely like an allergy. So general fact is that 80% of ear canal infection is allergy related. 80%. So it's like a plenty of them. If we have an allergy and we have an ear canal, during an allergy, what's happened? So we have some kind of inflammation, and ear canal can be swollen, but it will be swollen inside. Okay, so it can get more and more narrow. It is more and more narrow. It's not able to breathe correctly. So I'm talking about the changing the air from between the ear canal and outer space. I would say if the changing of air is not okay, especially the yeast can grow up and can cause some kind of inflammation, and then consequently infection, and then the secondary bacterial infection is coming, and we have to deal with this kind of condition. If dog has this kind of problems regularly, like many times a year or during a life, so the ear canal can get narrow like constantly. And it's like a circle, and then you have to do something with this. So if we are talking about an anatomy, dogs, they have a vertical and horizontal canal. Okay, so and usually the problem is a vertical. It's with this kind of vertical canal, which one is more narrow than a normal. So usually at the beginning, we used to start with which one called lateral ear canal recession, to get rid of basically of vertical canal, and remove the vertical canal and open it. So then you can see the dogs, they have really something like a hole here. Sorry, like a hole here on the head, and it can help. If this one is not helping, or even though if the dogs develop like a chronic ear canal infection with middle ear infection, then you have to do something more, and we call it a TICA, or total ear canal ablation, which means to get rid of whole ear canal. But it means when you remove the whole ear canal, you have to remove a tympanic membrane, go inside the middle ear, and clean it proper, and then stitch it up. Two things: you get rid of source of a pain and infection, because it's no more ear canal over there, but the dog is getting deaf because it's not tympanic membrane over there. You have to close it.
Yeah.
So has a pros and has a cons. So, but generally speaking, total ear canal ablation is the end stage when they fail the other treatment. Okay, so it's the end stage. I wouldn't be happy if someone to just come to me and just tell me, so listen, I would like to do a TICA with my dog because of this or that. So that's not good approach to do it like a first treatment, to do a TICA. And if you are talking about the TICA, like a total ear canal ablation, and you mentioned some dangerous or something like that, so it's dangerous. It depends, because you are working here and you have a facial nerve over there. You have like a bunch of a facial nerve, and even though if you are doing it perfectly, you can tease the facial nerve, and which might occur that your eye will be not able to blink after procedure. And it might be temporary, but sometimes it might be permanently. Okay, so if I'm right, maybe I'm wrong, but if I'm right that almost 10% of dogs has this kind of problem, which might be permanently. So, but what does it mean? If your eye is not able to blink, you are not able to spread the liquid on your eye, and you can easily develop eye ulcer, which is another kind of a problem. Okay? And it's a big problem to have an ulcer on your eye. So yeah, it might be kind of a dangerous procedure.
Just a little bit. Thank you.
So that's a reason why I don't like this kind of a procedure, even though it is on a head, but I hate it.
Hmm. Thank you. Thank you for explaining that. And then the final topic that we have for today is questions around cognitive function. You
Okay.
mentioned this at the beginning and in your introduction, and it is a very interesting topic because the statistics you presented, they sound a little bit crazy for me. You said 68% of older
Almost
dogs.
everyone. Yeah.
68%. Insane. That's a lot. That's a lot of that's a lot of percent. So
It
uh,
is.
how can we help dogs improve that number? What can we do to make it less than 68%? So the question that we have here is, are there ways to improve cognitive function in older dogs or to slow down their cognitive decline? What are the early signs to watch out for?
How can I start?
We
How
also
can
have a question about how you can diagnose the early stages of dementia, if you want to speak about it together.
I don't think so that it exists some like a specific test to diagnose early stage of dementia. If exist, please send me, but I'm not aware that it exists something like this. So usually, as I mentioned at the beginning, so the signs might be really subtle, okay, like vocalization and stuff like that. So first, we should rule out the other condition, which one we can rule out, like joint problems, osteoarthritis, pain-related problems, and so on. If we rule out everything, then we can potentially start to talk about some kind of dementia. So let's speak about how can we recognize, or how can we I'm just thinking what's gonna be the best option for us to explain. Maybe how can we recognize, and then how can we improve them. So how can we recognize? Sometimes it might be really obvious, like dogs, they might looks like that they stacked, or they looks like they are lost. They might stare on a wall. They might stare into a corner. They might go somewhere and then suddenly realize that they don't know where they are and go back, like walking with no obvious reason. Okay, so sometimes they might have a difficulty to recognize people they should know. But here you should be really aware that they don't have different kind of a problems. Like my dog has a cataracta, which means like a milky eye, and he's not able to see correctly when the night is coming, for example. So it's not dementia relating, but it's relating to eye problems. Okay, so again, we are talking about, at the beginning, we have to rule out different kind of disease, which one we can rule out, for example. As well, they might have a different kind of sleep pattern. They, it's the same like with the old people. They are not able to rest and sleep the whole night. So they sleep in short periods and multiple times. And vice versa, sleep more during the day. So again, it's basically the borderline is very, very thin. what is okay, what is age depend, and what is not, what is already dementia or not. But you can see, for example, vocalization is a perfect sign. So they might do vocalization during a night without any obvious reason. For example, okay, they might have, for example, new phobias or new fears, for example, they didn't have before, and they might be more edgy, a little bit more have a, they might increase the agitation, for example. Then they might forget some normal comments like sit, stand, and so on. Sometimes they have just delay between commands, like you tell to something to your dog and he's just thinking. But again, here you have to you need to be sure that if my dog is getting deaf or just ignore me today, we have terriers, you've got Shar Peis, they might have this kind of
Yes.
plans that today I'm gonna be idiot and I'm gonna ignore you whole day. So
Well, in our case, it's they know better.
yeah.
They know better, so they will do what they want today.
Okay.
And if
So
you don't like it, they might get upset at you.
so they might, for example, they might hunt or chase like a invisible flies, for example, and stuff like that. Okay, so it might be the signs of dementia. So it's not really easy to speak about and to like diagnose. Okay, so your dog has dementia and that's it. Okay, so I would be really happy if it will exist or would exist some kind of test for dementia, and we just literally test like a blood. Okay, so your dog is not idiot, he's got the dementia, and that's it. So that's the science. But how can we prevent? We were talking about physical exercise, but the biggest muscle is the brain, I would say. Okay, and we should exercise as well and stimulate the brain. So I mentioned about this, and especially the lady, which one we have, she needs to do plenty of mental stimulation, and sometimes we switch work to a mental stimulation. So even though when you grab the dog and when you go out and your dog is willing to sniff, for example, now we have a autumn and plenty of leaves on a street, so it might be really interesting for dogs. So we used to leave them to sniff a little bit more. So a general fact is telling that 10 minutes of sniffing is equals like a 1 hour of a walk. So it can really help. It can really stimulate the brain. So that's the first thing. Let your dog sniff, okay? Because they communicate. They can communicate between each other. As well, you can learn like a new tricks. I'm not talking about jumpings or stuff like that. But for example, uh, touch the nose, or like give me a paw, give me another. Okay, or sometimes it's more than enough for mental stimulation. Of course, that the dogs they are okay with sit, stay, stand, and so on. But from some days or for some days you can do it a little bit differently. For example, today I'm gonna focus on sit, and I will give him this command maybe 50 times. Okay, will be different for dog, will be another kind of a stimulation, and dog will be happy in a general. So that's a way how can we improve mental stimulation. Then what about as well? It's like I would say it's a connected, the physical exercise and mental exercise. So we cannot do one without the other. So as well, the physical exercise can help to improve the mental stimulation as well. It's like with the human being. So if guys, some of you, if you visit the gym, you know, when you go to the gym, you do exercise, you are full of endorphins later on, you feel better that you do something good for you and you really feel better. The same with the dogs. So as well, I would recommend to do a regular physical exercise, but as we were talking previously, do a slow walk, for example. Okay, this is really good. Sometimes you can, even though you can change the routine, but don't do it like every time. For example, if you used to go on a walk around the 3 streets clockwise, go anti-clockwise, okay? Or prolong it or change the direction, whatever, okay? So change do the routine, which one can help dog. They feel safe if they have a routine, they're like a robots. But sometimes you can a little bit change it, and it's really good for a mental health. So
This is really great advice, because a lot of times when we hear mental stimulation, it means, you know, dog puzzles or throwing the ball, playing fetch. And a lot of, for example, Shar Pei don't like to do that. They don't see the point in puzzles. They will either not be interested or break it, or that's the end of the puzzle. And not many like to play fetch.
yes,
You can throw the ball once, you can throw the ball twice or 3 times. On the fourth time, he will look at you and say, "You go fetch it."
yes.
And that's it. They're not terriers like yours. So mental stimulation can be challenging, or at least in the minds of people, it can be challenging. But with all of the examples you gave, they're super easy things that we can actually do every day, and it still counts.
Yeah, or just change the toy. For example, I don't know, so I can have a look over there. Our dogs, they have like a 30 toys or something like that, and we still can swap them. So what is on the top is on the bottom, and vice versa. And they can still find like a new toys, for example. And back to my dogs. For example, Bela, as I mentioned, she is from shelter. She doesn't know how to play with toys. She is not interested into. So we had to find out different way how to stimulate the brain. So she's okay with mice, outing the mice. So I just let her outside and dig it, and it's really work. It's really work for her. Regarding toys and fetching toys or fetching balls, please don't use a regular tennis balls because it can destroy teeth. Okay, so there's like a uh, little bit dental thing, but again, so you can change the toys to make them attractive. Okay, so I will grab ball, the other I will grab I don't know, frisbee, for example, if they like it. So, but if they don't like it, so it's not point to take with me, for example.
But even changing the direction of the walk, making the walks a little bit, that also
Yeah.
counts as mental
No, it
stimulation.
can it can it can help sometimes from time to time, maybe once a month. Grab the dogs, jump into a car, go to a different park, okay, and you'll see they will be really excited. And after 1 or 2 hours of a walk, like exploration of the area around, they will be completely dead when you get home. So
Yeah.
so that's another thing. The problem is when we have a shitty weather and it's raining outside.
Mm.
So then you have to do a little bit differently and you find out what is really good for your dogs. And I would say the sniffing or snuffing pads, if you know what I mean, sniffing pads,
Yep.
they are working perfectly. So even though it's not necessary to put a treats over there, use a regular dry food like a kibbles over there and just hide it. Play the game, hide and seek. Okay, so it's not necessary to have crazy puzzles, which one I'm not able to solve. And if you don't have a sniffing pad, use a rag, for example, and fold it and put it under. Put under the cushion, for example. So it's working as well. If you have an old T-shirt, put into a T-shirt and fold it, and you'll see they will like it usually.
Mhm. And this helps prevent or slow down cognitive decline and
It's a mental exercise. It's a mental exercise, and I mentioned as well about some supplements. Some
that was my next question. Is there a pill? Can we give them something?
If they are willing to eat, why not? Okay, so
What's the easy solution? Can we give them food?
means some of a food they already contain some kind of antioxidants like vitamin C, vitamin E, selenium, for example. But you still can give them some kind of pills. Then they are happy to eat it. Then fish oil, it can really help because it contains omega-3 fatty acids, especially DHA and EPA, and it's really good for cognitive functions, and as well it can help for joints, joint supplementations. Then some kind of a ginkgo biloba coenzyme Q10 can help. So I was trying to find out if it exists something like for veterinarians. I'm not pretty sure. So maybe here you have to use human pills,
And
but
it's safe for dogs as well?
still you have to check what does it contains. Okay, so we are not talking about the active substance, but we are talking about the additives. If you are not sure, just ask your vet if it is safe or not. So that's the best way. And if he tell that is a safe, then you can claim. Okay, so that's something like we call it like a brain boosting nutrients, and this can help. And I'm just thinking, I know what else. Well, sleeping. This is the most, no, most, this is the one of the important things. So if you are not sleep well, you are not feel well. Okay, so please be sure that your dog has a calm spot for sleeping. I know that we like them a lot and they are happy to sleep on a couches and sofas and so on, but they need to have a chance to go somewhere on a dark spot. There is no rush, there is no sounds, and just resting over there. Even though we have something like a rule, our dogs they have sleeping pads or resting pads, and we do nothing on the pets, even though dental cleaning. So the pets are for resting, they are for sleeping, and it's their personal spot. And I would say this is a good choice how to as well improve mental health. Okay. So because dogs they are sleeping, sorry,
Mentioning that.
they are sleeping 8 hours a day is like human beings. So it's a 1/3 of a life, and you have to sleep perfectly and well.
Thank you for mentioning that, because that goes hand in hand with a calm and stable environment at home, and I think that plays a very important role. And I probably all dogs, but especially at least in my experience, Shar Pei are very sensitive to what happens at home, and a lot of their health issues are linked to basically what's going on around them. It's their response to their surroundings. So yeah, a safe and nice place to sleep is a perfect comment to wrap up our conversation today, I think. Thank you for bringing that up, and thank you for patiently going through over all of our questions that we had today and giving us detailed and very interesting and insightful answers for that.
No need.
Let's welcome back Viera.
Hi, yes, I am back. How you feel? You should be tired.
Who, me?
Yes, yes.
I
She
don't, I
was
don't,
shooting.
I,
She
I
was
don't,
shooting at you
I don't,
from
I
the
don't want to
different
tell
areas of the
how I'm feeling, but I need to go on the toilet.
Time, time.
I drink a water just in case, you know, it's not a good idea to be dehydrated, but maybe I overdrank, so
Our conversation went a little bit longer than planned, but
You should
thank
be
you for staying with us.
you should be strong. You should be strong. Yes, she was shooting at you from different areas, veterinary medicine, and it's not easy to answer. That's really thank you. It remind me some, I don't know, months ago, my friends asked me, Vera, why you are doing these seminars and articles and these activities? And you know, person full of love to my dogs. One is a veteran also. My answer was because I want my dogs to live forever. I know it's not possible, but our goal is to do everything we can for our dogs so that they can enjoy a high quality of life even in later years. That's why this information you share today is so important for us, and I would like to say huge thank you from my side. I believe from people who join us also will join us because we leave this video sometimes in our page on Facebook. And okay, Victoria, thank you. Great job. I'm sure it's not the last time we use you for live broadcast, and because our guest is in hurry, I would like to say thank you to everyone who tuned in, and we wish you all pleasant evening today. Now I stop live stream. Bye bye.
you guys.
Bye, everyone.